What are your projects working on? About, for example, diabetes?
Yeah. Diabetes, as everybody knows in this world, till today it is incurable. This is one thing. On the one side, the world is saying that it is incurable, whereas on the other side, Ayurvedic masters, they are saying that some of them are curable. When you get diabetes, everybody says that you don't eat sugar. But as you know, everything in the world has some amount of glucose. So in a way, you are just reducing high glucose, but low glucose you are taking. So you can, and you need glucose. You cannot ban that because you need for energy, you need for different things. So basically, it's not enough to stop sugar. Means you should have some glucose content, but you should stop sugar. But besides that, there are some other things like potatoes, for example, starch contents, or these has a high amount of carbohydrates. Fried stuff, most of the fried stuffs, they have a certain amount of carbohydrates. They produce. So these kind of stuff they have described in Ayurveda, which people don't bother. They don't eat sugar, and then they start eating potato chips and everything and McDonald's. So your sugar is not going to be controlled anyway. Another thing, what is happening, as everybody knows that it is incurable, so we are entering a vicious circle. We are taking some hypoglycemic agent, means some medicine. So that medicine will reduce the sugar. So we should not go in hypoglycemia, we eat. So we are eating, producing sugar, we are consuming. We are eating, producing sugar, we are consuming. So we are entering in that circle. There is no way out in that circle. And all this is happening suppressing your natural system. Because you are taking supplements. You are taking hypoglycemic or insulin. And that's why you get complications. So you are not curable and you are prone to complications. What we believe in, that basically we are not using hypoglycemic agent. Our herbs or whatever principles we are using, they are normalizing agents. So what it is doing? It is normalizing. So as it is not producing hypoglycemia, you don't need to eat. So you don't need to produce more sugar. And that's how you taper down. That's how you go down. You understand? And this is the principle on which we work. So our project is to normalize sugar on the basis of this examination described in the Ayurveda, which is the most important thing, and very few medical disciplines describe that. For example, day sleep, which is one of the worst things in diabetes, in obesity, especially after food, or search for comfort, laxity, laziness. These are one of the worst things in diabetes, or stressed out. These are one of the worst things in diabetes. So these kind of recommendation in behavior means, for example, if you have an office job, you have to sit 8 hours in the chair. What we do? We suggest them to do exercise on the chair. That's fine. Use of AC, not tend to sweat much. These kind of stuff which comes under behavioral pattern, which is bad in diabetes. And lastly, the special exercise, which is concentrated towards belly movement or bicycle. This is what we do, we recommend, and people get benefit of that.
What are the results of your study?
Yes, my study, okay, as I told you, we are doing some studies. There are 2 studies going on. We were able to bring all the uncontrolled patient into control. We got a big amount of reduction in glycosylated hemoglobin, or HbA1c, which is showing the control of the body. There is definite reduction up to 40% in sugar levels within 3 months. And the quality of life was much better. The people who were having complication, this complication they don't have anymore, which is surprising.
Complication like what?
We worked on diabetic retinopathy, diabetic neuropathy, and diabetic nephropathy, and diabetic foot. These are the 4 main complications. We have really achieved good in diabetic retinopathy. We prevented people from having lasers or surgeries. We really achieved great in diabetic foot. We prevented even from amputation, gangrene. Neuropathy also has a great result, and what is really not that much great is nephropathy.
And is it possible for Westerners to come to your place to get treated, or are you still only doing studies?
It's been 14 years I'm practicing, so I'm not just doing studies. I had a big clinic and I'm working in a hospital as a consultant, and if you come to India, I'm the super busy consultant. I don't find sometimes time to eat even. That's not a problem. Westerners can come for the treatment. But sincerely, what I believe, there are two parts. You can come, you are welcome, because as a patient you will definitely get some help and you will be better. And so I get a number of patients from different places. This is a personal view. This is the personal benefit. But my personal view, my opinion sincere is the country you grow, the food you eat, to get better in that soil is the best thing. That will not bring me maybe fame, that will not bring me maybe money, but that will definitely help you more than what you achieve in India. And this is what is happening. People come to India, they get some panchakarma somewhere in South India, somewhere else, or in our clinic, they feel great, and then they come here, they go down. Because the situation there you are not working, there you are not stressed, there you are not having cold, there you don't have 8 months of grey weather. Everything is fantastic there. There is beautiful nature, there are massages doing you massage, you are having swimming pool and everything, so you are great. But if you do same thing here, you will be great. But when you are doing your day-to-day life with this climate, with this cold, with this food, and if you receive the treatment in that climate, that is much more beneficial than something different. This is my personal view. And I strongly believe in this, and this is what Ayurveda says. Okay, still if you want to come, you are welcome. That's not a problem.
But so that means you need to teach people here.
Yes, for sure. Okay,
know.
Initially you have to come. Another couple of years, 4-5 years, you need to go to India. This is true. But if it remains same after 5 years, then it's difficult.
Okay. One last question.
Yeah.
Is there anything you would like to tell our visitors on our Ayurveda platform, or to give them as an advice, as a recommendation for their life, for their
recommendation? There are big recommendations in Ayurveda. To make it short, it's really difficult. But few things. There is a saying in Ayurveda: what you eat, what you get. So concentrate on your eating, concentrate on your daily lifestyle. 3 basic things you follow, it's fantastic. If you could have good digestion. Digestion doesn't mean just passing stool. You should pass everyday stool, but with empty stomach, with clear barking. So if you have good digestion, if you have good sleep means at this moment if I tell you to sleep, you lie down, you sleep in 1 minute. That is good sleep. And if you have calm mind, you achieve everything. Digestion is possible, sleep and calm mind is difficult. For that, you just need to start neglecting few things. This is a new things we advise now, our patient, art of neglecting. Means, for example, I know that you bother me, you are my boss, you bother me, you are wrong, so I am stressed. Okay. Is that going to change the situation? No, because you are boss. So even if you make a mistake, you will be always correct. And even I am correct, I will be always wrong. So start neglecting. Don't think about boss. Think he is not existing. Just work. It exists in the work. The moment you leave the office, it's finished. Even what he speak, if he's shouting, he's shouting. It's been 10 years he's shouting, I'm working with him. Just neglect. So detach from the stress, because what is stress? Excess attachment to something. So detach from that. For that we advise few things like count 1 to 20. When you started to be angry, count 1 to 20 loudly. Or start dancing or something like that. Means detachment. And that will really give you good sleep. That will really help you to be calm. So have good digestion, have good food, have good sleep, and stay calm. That is the advice.
Wonderful. Thank you very much.